you, everyone, for joining us today. Really appreciate it. My name is Ronan Wisdom. I work for Accenture, and I'm a freshman. This is my first Rock Health Summit. And it's really impressive. Such a great organization. As somebody from Accenture, though, they did throw me straight away. They said no slides and you should wear jeans. So forgive me as I work through this discomfort. I've got a really great panel. We've been chatting backstage, and I'm going to ask them to introduce themselves to you. But as we're going to be talking about how non-traditional players are shaping healthcare transformation, I'm also going to ask them to tell you a little bit about what they do, but also why they decided to enter healthcare. Jim.
Sure, absolutely. So I've been at Goldman Sachs my entire career. I started on the equity research side and actually took a job out of college in the internet group in 2001. Because it was really exciting, and we were going to cover AOL and all kinds of companies. And when I came back in 2002, that job didn't exist, and they said you have one job option, and that is covering companies in the healthcare services and distribution sector.
Easy choice.
Yeah, exactly. Which I knew nothing of, but spent enough time there to really appreciate the complexity of the system, and then pivoted over to the investments banking side of Goldman and cover companies on the healthcare technology and healthcare services side of things.
Great, thank you. Heather.
Well, I'm actually a newbie to the health space. I've actually only been working in health for 2 years, compared to many people in the room who have spent most of their career in it. I currently work at Microsoft as a GM for our Healthcare Next division, which sits within artificial intelligence and research. And we specifically look at new experiences in technology. Prior to joining the healthcare experience, I actually spent 10 years at Amazon doing startup businesses in big, messy spaces, launching Amazon Fresh and the automotive store, running consumer electronics for a period of time. So quite a diverse background.
Sure, thanks. Chris.
Great, thanks for having me. Started a career at Specialized Bicycles, where we were using medical devices in reverse to boost hematocrit levels, and some of the team dabbled in Amgen tools, but not anyone that I knew directly. Then went to IDEO, spent 10 years at IDEO, and then went to One Medical, and now lead design innovation at Sutter Health, which is the 8th largest healthcare system in the United States. 94 babies were born today at Sutter Health. It's about 1,000 patients an hour.
Wow, thanks. So as everybody in this room knows, healthcare is easy, right? Disrupting it is pretty simple. And so our first question, and Heather, I'm gonna ask you to start us off, is in a space that is really genuinely difficult to disrupt, why are non-traditional players looking at entering this market now? What trends are we seeing that's enabling them to think that they can make a difference?
Yeah. Well, I love the question, because if you think about where entrepreneurs and startup companies go, they go where there's a place to solve a problem. They look for opportunities. And if you go and search for what the top concerns are in healthcare, you can find thousands of articles and stories about it, but you need to look at the dates, because the topics are always the same. Sustainability, broken consumer experience, but you got to look at the dates, because you get the very same story from 2017 or 2000. The top problems haven't really changed that much, but what is happening now is new players are coming to the scene, and I think there's really 3 reasons that that's happening. The first is some of the transitions in IoT. There is affordable technology now that is bringing whole new sets of data that we are able to digitally capture what humans are doing outside of the traditional healthcare framework. And it happens certainly in the healthcare space, but it's happening in all other industries as well. Things like GPS, which certainly weren't originally created for healthcare, can now be applied to the healthcare space when you're looking at things like mental health or helping people get to their doctor's appointment in an easier way. So IoT is one of them. I think the second one is really the evolution of cloud technology and what that allows people to do. Certainly to store all that streaming data that's coming in, but also the compute power, where we can bring in asymmetrical data sets from different industries that may not be healthcare related, but can be combined with traditional healthcare information and light up a whole new series of learning about humans. And then the last piece of it is that we are starting to see in the industry, as those two things come together, they're doing what we see drives the true catalyst of change in healthcare, which is research. I talk to physicians endlessly, and every time I ask them the same question is, what drives change in healthcare? And the answer is always the same, which is research. And so if we're able to actually bring in some of those outside data sets and prove that they are able to deliver actual change and validate it, that's going to start bringing the validation of those other data sets into the industry, and that's why other people are coming to play.
Sure, very valid. Chris, same question.
Yeah, sorry, the question was unlikely.
Yeah, why
pairings.
are we seeing these unlikely pairings now?
Yeah, I think, it's cost. Cost is a driver. I think people fed up with the experience, and overall just thinking about who those unlikely pairings are. So I need to get to the fires right away, because that's a big part of what we've been dealing with the last 7 days. And if we look at unlikely pairings that are making a massive difference, we shut down a hospital about 7 days ago. It reopened today. 2,800 employees were displaced, and we had a lot of patients that needed help immediately. So unlikely pairing that was incredibly helpful. Lyft, ride-sharing services, within 24 hours, we had the region geofenced. We had all of our locations geofenced, and we texted those employees saying, if you need a ride for anything, it's free. And that will go on until the end of the month. Today, we announced the same for patients. And so it's an unlikely candidate, Lyft ride-sharing services, that's made a radical impact in a short amount of time in a big problem here and now. So just wanted to mention that because I'm thinking a lot about that this week.
Sure. And Jim, are there trends that we're seeing, such as the rise in chronic care cost, that are driving this?
Yeah, absolutely. I think that is certainly part of the cost equation. I also think an important aspect of why this conversation is happening now with such intensity, and it feels like every day there's a new article out, is, historically the healthcare industry, especially on the therapeutic side, has been, if we can't build it internally, we'll absolutely go acquire sort of the next best alternative from a therapeutic standpoint. And whether, that's been a facet of healthcare for decades. The sheer size of the dollars and the companies tackling some of these questions, whether they're from the data side, whether they're from the engineering, device engineering, hardware side of things, it's created an issue where the incumbent healthcare participants really can't acquire that future R&D pipeline in a way that they're used to historically, and it's invited this question of how do we interact with large companies that are putting tremendous amounts of dollars to work solving some of the healthcare problems that have been in existence for long periods of time.
Sure. And Heather, what types of organizations stand to be successful? What type of non-traditional players do you think are going to have a shot at really disrupting healthcare?
Well, I'm going to be a little biased in my answer and say that I do think organizations that are focused more heavily on using artificial intelligence and applying machine learning to their data are going to see more traction. I think there's really 3 levels, though, that it will expand. The first and foremost are those that are able to help leverage the data that already exists in the industry. There's a ton of operational data, financial data. I think the financial payment system is probably some of the most studied data by data scientists in the United States. But combining those data sets together and finding ways that hospital systems can improve efficiencies, identify fraud, get waste out of their system, just be more operationally efficient, are going to see the easiest traction and the fastest. And I think that's going to then evolve to companies that are looking at tools that really empower physicians. And so again, around that AI bent of how can we automate redundant work that physicians have to do so they can use their time more efficiently? How can we help the hospital staff be more efficient? And eventually that will start to move to predictive analytics. And then the last piece of it is really purely on the consumer side, is how do we start lighting up healthcare outside of the hospital? And so the companies that are able to get that data and bring it into the existing work streams, because work streams are hard to change, especially in an industry that does not change rapidly. It has a lot of regulations, but the companies that can get that data into the existing work streams and start to illuminate what's happening to the patient outside of the hospital walls are the ones that are going to see the big traction.
Sure. It sounds like data is the key currency here to success. Chris, are there areas that you're seeing where that's both true, but also thinking about retail and those organizations with infrastructure, which might be taking away vaccination services and so on? There's other aspects of transformation that's happening that is both not as data dependent,
right,
and is kind of retail oriented.
Right. So I think just to step back and look at in any human's experience with a health system or a digital experience is there's an emotional component, a physical component, and an intellectual component. Those are three oversimplified ways of describing it. Physical is done pretty well. Intellectual is done, just think about a common scenario of a patient arriving after anesthesia. That's the wrong time to give them post-op instructions, obvious. But the emotional is one of the greatest opportunities. And so what we're debating right now is what will be human, what will be digital, and what will be the right combination of those things. And retail will have some role to play in that. It may be diminished, but it's interesting to just watch what's happening. So Apple announced today, or there's been rumors that there's been discussions with Crossover Health and One Medical. That's really interesting because Apple does retail well, and they also do digital well. And so what will that ultimately mean in the disruption of healthcare as we look at this balance between the human and the digital aspects? There are those that wish it could go all digital. From what I've seen, we're not delivering babies digitally anytime soon. We're not doing open heart surgeries digitally anytime soon, though the Da Vinci robot's very promising and interesting. I think what that balance of human and digital will be is ripe for the architecture right now. And it means that many of us need to collaborate to create those experience architectures and not just pull against each part, because ultimately you leave an end user confused, uncared for, and non-simplified. We're actually making it more noisy, not less, in the current state.
Sure. So those companies that best understand the end user obviously also have, a really good shot. Are we seeing different behaviors from different populations in terms of accepting this kind of non-traditional approach to healthcare? Heather.
I can jump in on that. Yeah, I think there was an interesting milestone last year when you look at population sets. The millennials actually surpassed the baby boomers for the first time. Now, legitimately, both are about 75 million strong. But the approach in healthcare for those two demographics are very different. And one aspires to the traditional methods that we've used, but millennials, especially because they are not at an age bracket where they are needing, hopefully, heavy chronic treatments or heavy use of medical systems, they really treat medical care like retail operation. And so that makes them more open to different ways to administer healthcare, different tools that they're willing to use, going to places, different places to get their flu shot. They don't have to go to their physician's office in their mind. So that opens up the doors to ways that we can try and apply new, either technology, new experiences, new ways to deliver healthcare.
And to Chris's point, that opens up those unlikely pairings, right?
Absolutely.
Where folks are willing to accept and pay for services outside of a traditional context. Sure. Jim, what are the challenges? What are these companies going to have to face?
Yeah, I mean, just picking up on something that I think Chris had mentioned, I think there's these spheres of innovation where it's much easier to partner around the solution and create a collaborative environment than others. And I think Heather's example around the data, there aren't a lot of organizations in the traditional healthcare sense that would stand up and say, yes, our data science organization is best in class. That's a place where they, I think, recognize the need for more data to justify and value the therapies they're bringing to market, the price points they're bringing to market. I think on the consumer electronics side, there's certainly very few healthcare organizations that would stand up and say that's something in-house we need to understand. But when you get on the engineering front, the product engineering, the sensor, the miniaturization, the new completely step function changes in how we actually deliver technology through, whether it's drugs or medical devices, I think that's the more interesting place where companies coming at it from a non-traditional sense are really struggling with whether they need to build the full value chain down to direct salespeople, down to an entire medical affairs organization to justify those devices through payers, or they can collaborate. And the system today, I just don't think is set up that way to collaborate when the vested interest is to protect your profit stream. But you have to do that on behalf of shareholders. It's not because they're bad organizations, but those are, I think, some of the challenges around this pure question around collaboration. I think the other thing that non-traditional healthcare companies are doing a much better job in our dialogue today than probably 5-10 years ago. 5-10 years ago, the approach to healthcare was, gosh, look at the addressable market size. Look at how trillions of dollars on healthcare spend. We have to, as a function of growth, figure out a way to get into the healthcare market. I think it's flipped a little bit. I think those organizations are spending more time thinking about not only the addressable market size, but whose addressable market am I eating into? And how can I align, collaborate, anticipate the reaction of some deeply embedded motivations and cross currents in the healthcare ecosystem to really drive value on the cost side. And so I think those are challenges that exist, but are being addressed very, very thoughtfully by a lot of companies on the non-traditional nutrition.
Sure. So whereas, in years past, we might have just looked at an addressable market and said, that's big and significant. Now, as we're looking at transformation, there are other players in that market that are going to resist that change. I think the flu shot example for where millennials are perhaps just as comfortable having that in a retail setting as in a doctor's office is a great example. So Chris, how should incumbents react? What should traditional healthcare organizations do in the face of all of this transformation?
Yeah. I think a role like our group's function is they need to open the doors. So one of the unfair advantages that we have is just location. I'm right down the street in San Francisco. A lot of really intelligent people in this room right now trying to do very dynamic things in healthcare. And it's the collective wisdom coming together to say, here's what we could do collaboratively to make that happen. That's really compelling. So traditional health needs to move from the alpha state to the collaborative state, from we keep the patients and whatnot, to we both have really interesting things to add, even if you're a startup, and look at that as an interdisciplinary team, multidisciplinary team, looking at that, saying, here's how we'll architect that together. I think that's really valuable, and we're seeing a lot more of that kind of activity now, whether that's with a big outside player like Google or Lyft in the example that I gave earlier, or a smaller startup company. I remember if the Omada folks were here when that was just a Post-it note at IDEO, and look what that company's doing now. Watching Sami and his company grow at Averta. Those are all really interesting pieces of the puzzle that need to combine into an experience that changes lives. And I think we can't section them off too much. We have to look at those together and say, how can we impact more lives faster, instead of trying to carve out business IP and then protect that against each other. That's not working in service of people that desperately need this stuff.
Sure, it's a great point. So as you think about the non-traditional play, the startup that we're going to start in the morning, it's important to think about how you're going to collaborate with the incumbents and scale that and help them scale clinical beyond the clinical setting, right?
Right.
Yeah. Heather, same question. What do you think incumbents should be doing?
Yeah, well, I think the important point is that if you look at how technology is going to influence healthcare in the future, there really isn't a single player that's going to manage it all. It's complex, and so I envision a world where you've got a contributor of the data, you've got a contributor of the medical knowledge, because if you are working from a machine learning perspective, somebody needs to keep monitoring that and managing it from a clinical perspective, and then you need the data science or the computer science behind it as well, and there's probably a fourth person in there, which is the UX experience, which may or may not be in the hospital setting today. So the future is going to be a collaborative experience unto itself, and kind of the other side to think about it is just the natural way that we've been practicing medicine historically, there's a natural bias based on research itself today that happens. The more data that we can put together and the more systems that we can have where it's easy to do that, the better outcomes we're going to have, because we're going to be that much smarter and have that much more insight. So it's really a collaborative effort as we go forward. And I think that's a mind shift that we need to embrace in the industry as well, that it's not a losing market share, it's gaining insight and being able to operate more effectively.
Right, and that probably moves all the way back through that into teaching, right?
Absolutely.
What we're teaching
Absolutely.
at medical school needs to embrace not only the technologies that are transforming, but also this open, more collaborative approach to solving real problems.
Absolutely.
Jim, any thoughts?
Yeah, listen, I think I agree both with Chris and Heather. I think collaboration is the best way to insulate yourself from real disruption. I think healthcare adoption curves look longer than other industries. Change is slower a lot of times. There's a lot of gatekeepers with respect to regulation, with respect to proving clinical effectiveness, and I think companies can sometimes be fooled into that the slowness of it all being confirmation of the value proposition without necessarily needing to work with others. But it does it does happen. I think in Chris's world, hospital systems that haven't invested beyond the inpatient hospital are really, really struggling today, right? And it took a long time of very incremental volume shifts into outpatient to start to really move the needle in meaningful ways for hospitals that saw that ahead of time. And so, I think that is true across the board within healthcare, and we'll see how it plays out.
Yeah,
Sure.
kind of threading a few of the comments that are being made here is, 99% of the time, or 99.9% of the time, you're not in a clinical setting, and so the incumbents need to realize, that's not where health is happening. It's happening in 99% of the time when you're not in there, which is what many of the startups are about. But yet you need to share that data and commingle it back so that we're making better decisions if, unfortunately, you are in the context where you need care, but then you're in that care. So how'd you get there? If you needed a medication, did we deliver that to your house? Did you need to come? Could we have done that virtually? Right. So starting to piece those storylines together, and then going all the way to let's take it to the greatest degree of care, transplant, surgery, which happens here in San Francisco. In order to qualify, and eligibility requires a stay in San Francisco for 30 days. Try finding housing in San Francisco right now for 30 days. That's really difficult. Hey, who else does housing? Airbnb. What if we certified healthy homes? You've got a place to stay. We're giving you rides to that appointment, and now you're upping your eligibility for that much-needed transplant. So the collaborations are across the board, from the 99.9% of the time when you need health interaction in your day-to-day life, to the deep end of health where, sadly, you're in a position where you need serious medical intervention, and the collaborations don't stop. That's not for healthcare to own this side and digital health to own this side. It's a continuum that will continue to evolve over the coming years and months, and data is the imperative link in all of that.
Yeah,
Sure.
Just to thread on that, there's another key element that you brought out, which is absolutely essential, because just because you build the coolest technology possible doesn't mean anybody's going to use it. And what you were hitting on was the frictionless experience for consumers. Healthcare exists today, but it's hard to get to for some people. Low income, just proximity of care, cost, and so the solutions that are going to bring us ahead are those that remove friction from the system for the end consumer. And that's really going to be the big win.
Yes, agreed. And the least inspiring place to go would be a healthcare conference, with the exception of Rock Health. Of course. Because that's not where the fuel source is. I think South by Southwest is inspiring to our team as anything else. And, working with Nike and others and what's going on in their innovation teams, and just listening and understanding. Because what a brand like Nike does pretty well is motivates. What healthcare does not do well is motivate. So how can we commingle insights to get to the greatest challenge, which is motivating someone beyond providing information? Healthcare will provide information all day long, but how do you motivate? So just those, unlikely pairings where we're going to collide to do something magical.
Sure. So Jim, are there lessons, are there things that incumbents can learn from the non-traditional players that maybe okay, they have a naivete in some ways that, there are barriers, there's regulatory, there's value chain, there's all these complexities, but they also do have an agility and a fresh perspective that, sometimes is lacking or is difficult in the incumbents. So what can incumbents learn from non-traditional players?
Yeah, listen, I think they these are not monolithic organizations that have ever faced down threats or competition before. And so I think you do see a lot of the companies on the large cap healthcare side, whether that's services or science. I think building offices here, trying their best to attract talent, building some capabilities to at least allow them to have intelligent conversations, with companies that are doing very interesting things on the data science side or on the product engineering side. And so I think they are, I think they're learning, and for the most part, we don't see a lot of the incumbents that we cover really reacting in an insular way. I think push comes to shove, I think push comes to shove around price and around justifying value of therapies that are in the market. And I think we're still in the very on deck circle of before the game started there. But I think for the most part they have taken note of, I think, some pretty interesting innovations that are coming out, and announcements every day. And they don't want to feel left behind. There's certainly exceptions to that rule, but for the most part, I think they're trying to play catch up.
Sure. And Chris, anything from the perspective of personalization and consumer centricity that we see in non-traditional?
Yeah. We ask a lot of people, like, what day of the week does healthcare feel like? And it feels like a Monday most times. Sometimes people say it feels like a Monday after a 3-day weekend. And what's interesting when I ask that question is employees say that too, right? That it feels like a Monday. And so part of it is incumbents just realizing that we can change the tone and the nature of it. One really interesting place to start is healthcare employees themselves. 1 in 10 Americans work in healthcare, and the average health of that population is poorer than the people that they serve, which is just mind-boggling in terms of thinking about where to start. Well, let's start with that population. That's an informed population. That's a population. We can unpack those reasons. Sometimes it's self-sacrifice. So I will not sleep because my patients, are ahead of everything else. So that happens, but I think there's more to that story that we should look at. So the incumbents just, again, just looking at the problem with fresh eyes, which we joked behind stage, you only get for about 3 years, and then that
And that's
expires.
it.
Yeah.
Then you're a lifer. Yeah.
Maybe, or I think it's you mentioned earlier about education. I think that's a key component. On the prior panel we talked about healthcare is very well equipped for, you're sick and you present a symptom. So there's one person presenting one symptom, getting a treatment plan, and usually it's multiple symptoms now, and we need multiple people meeting multiple populations, and inherently one-to-one is an economic problem. And any startup business would never launch one that's like, I need one person at a time to meet one other person at a time for 12 minutes at a time. It's just inherently inefficient. The average time a study was done of a patient speaking about what they need before they're interrupted is 12 seconds. So that's broken, and it's a system design flaw. It's not healthcare's design. I don't think healthcare would have wanted it to be designed that way, but that's ultimately what happens when you get a poor efficiency ratio with too much demand and not enough supply. You're down to 8 minutes and 12 seconds before someone's interrupted. That's broken. And so looking at that as a place to start is that everyday use scenario and rethinking, does that need to happen that way? Can we go many to many, one to many, and every different ratio in between?
Sure. I want to end with one thought of, we all look forward to transformation, the triple aim, even the quadruple aim, where non-traditional players can really impact healthcare for good. There's some risk here, right? Heather, what happens if we don't have entities sharing data properly? What happens if non-traditional players are successful, but they're successful in silos?
Well, that's a real concern, is that when it's siloed, we don't get the value equation. And it can happen, but I think it's really incumbent upon the blend of the ecosystem. I don't think consumers will allow it in the future. I think consumers will be looking more for proactive information, and they're going to be coming in and saying, no, I want you to look at this data. We already hear that in some respects. You know, I'm looking at my sleep patterns, and I think there's something disrupted because they've got a smart watch on the wrist. They're going to start bringing things in, and so I hope that consumer drive is going to start that catalyst within the silos that are happening today. I think, and when we talk about silos, is that, you know, the ecosystems that do have the opportunity to provide the medical practice, get the data, apply the data science, and work on the technology. Those are happening in silos, I think is what we're referring to here. And so the more we can bring different data sets from different types of groups, consortiums, so that we can apply the research to it, is where we're going to really start getting proactive medicine instead of reactive. And that's really what needs to happen to really drive the efficient change.
Great. Well, look, Jim, Heather, Chris, thank you all for your time today. Really appreciate it. I hope you all found the conversation enthralling. So please give the panelists a round of applause.